Clinical presentation of a COVID patient. Case presentation. A 35-year-old female presents to the hospital with a fever, dry cough, and difficulty in breathing. She also reports feeling very tired and unwell. She has a history of hypertension, which is controlled with enalapril. Examination. Pulse is 120 beats per minute. Temperature is 38.7 degrees centigrade. Oxygen saturation is 88%. Respiration rate is 20. Chest shape is normal. While auscultating the patient, crackling sounds were heard in the chest cavity. The patient appears acutely ill, however. Lab test. Blood, complete blood count and sputum cultures. Chest x-ray. Computed tomography for the chest. PCR, that is polymerase chain reactions for severe acute respiratory syndrome coronavirus. Lab findings. Blood, CBC and sputum cultures show elevated white blood cells. Chest x-ray shows bilateral lung infiltrates. Computed tomography of the chest reveals multiple bilateral lobular and subsegmental areas of ground glass opacity. Positive for severe acute respiratory syndrome coronavirus SARS-CoV-2. Medical intervention. Admitted to the hospital in an isolation room. Started on oxygen. Continue oxygen saturation returns back to 94% to 95%. Intravenous fluids. Immune max 4 fluid. IV fluid. Venous thromboembolism prophylaxis. Azomax antibiotics. 1 in the morning and 1 in the evening. 1 plus 1 means that. Ivermectin 1 plus 1 for 2 days. Paracetamol 1 plus 1 plus 1. Hypertension medication as prescribed earlier. Physical therapy intervention. Short-term goals. Maintain patient oxygen saturation and lung compliance with deep breathing exercises and avoid fatigue. Phase 1. Deep breathing while on your back. Number 1. Lie on your back and bend your knees so that the bottom of your feet is resting on the bed. Number 2. Place your hands on top of your stomach or wrap them around the sides of your stomach. Number 3. Close your lips and place your tongue on the roof of your mouth. Number 4. Breathe in through the nose and pull air down into your stomach where your hands are. Try to spread your fingers apart with your breath. Number 5. Slowly exhale your breath through nose. Number 6. Repeat deep breathing for 1 minute. Phase 2. Deep breathing while on your stomach. Number 1. Lie on your stomach and rest your head on your hands to allow room to breathe. Number 2. Close your lips and place your tongue on the roof of your mouth. Number 3. Breathe in through your nose and pull air down into your stomach. Try to focus on your stomach pushing into the mattress as you breathe. Number 4. Slowly exhale your breaths through your nose. Number 5. Repeat deep breaths for 1 minute. Phase 3. Deep breathing while sitting. Number 1. Sit upright on the edge of a bed or in a sturdy chair. Number 2. Place your hands around the sides of your stomach. Number 3. Close your lips and place your tongue on the roof of your mouth. Number 4. Breathe in through your nose and pull air down into your stomach where your hands are. Try to spread your fingers apart with your breath. Number 5. Slowly exhale your breath through your nose. Number 6. Repeat deep breathing for 1 minute. Phase 4. Deep breathing while standing. Number 1. Stand upright and place your hands around the sides of your stomach. Number 2. Close your lips and place your tongue on the roof of your mouth. Number 3. Breathe in through your nose and pull air down into your stomach where your hands are. Try to spread your fingers apart with your breath. Number 4. Slowly exhale your breath through your nose. Number 5. Repeat deep breaths for 1 minute. Humming. Humming while exhaling helps increase nitric oxide production in the body. Nitric oxide helps with neural plasticity. Building and repair of the nervous system is called neuroplasticity. It dilates blood vessels, enabling more oxygen to be delivered throughout the body. Humming is also calming and soothing. It reduces stress and it can help the patient remain in restoration mode. Number 1. Sit upright on the edge of your bed or in a sturdy chair. Number 2. Place your hands around the sides of your stomach. Number 3. With your lips closed and your tongue on the roof of your mouth, breathe in through your nose and pull air down into your stomach where your hands are. Try to separate your fingers apart with your breaths. Number 4. Once your lungs are full, keep your lips closed and exhale while humming, making the sound. Notice how your hands lower back down. Number 5. Again inhale through your nose, then exhale through your nose while humming. Number 6. Repeat for 1 minute. Long-term goals: returning the patient to her daily life activities as she was before COVID, increasing her lung compliance and power. Home-based physical therapy program to recover lungs and overall health. Follow these exercises once you feel active without any fever and fatigue. Continue this exercise plan 2 times daily in a set of 5 repetitions for 15 days. Once you feel the difference, you can continue this exercise program for another 15 days. Sit to stand. Start by standing close to the front of the chair. Lean forward at your trunk and reach forward with your arms. Try to raise to stand without using your hands to push off from the chair. Use your arms as a counterbalance by reaching forward when you approach sitting and lowering them as you begin standing. Standing march. While standing, raise up your knee, set it down, and then switch to the other knee. If needed, use your arms for support by touching the back of the chair for balance and safety. Wall push. Start with arms extended with your hands on the wall and elbows straight. Slowly bend your elbows, lowering yourself towards the wall as your shoulder blades squeeze together. Then slowly push away from the wall. Keep your hands at the same level of your shoulders. Bilateral D2 flexion. Start with your arms crossed at the front of your body with your thumbs next to your opposite leg. Bring your arms up and across your body, opening up to turn your palms towards your face. And with your thumbs pointing backward, then return your arms back to starting position and repeat. Side steps. Start in a neutral standing position. Take a lateral step to one side. Follow with your other leg while maintaining balance and proper posture. Repeat for the prescribed amount, then repeat on the other side. Prognosis. The patient is expected to recover in 21 days. Home plan plus patient education. Patient should follow exercise in long-term plan to recover completely in terms of aerobic health. Patient needs to be cautious while doing exercises because this can cause fatigue to the patient. Patient should move to the work life in step-by-step mode in post-COVID scene. Patient should do proper rest and take adequate sleep. Patient should monitor her oxygen saturation for 1 week after negative PCR test. Patient should visit psychologist if she feels problem with her mental health. Discharge plan. The patient is discharged on the 21st day when her PCR test is negative. Continue calcium 1000 for 10 days. Avoid vigorous activities. Take foods that are highly nutritious like porridge, meat and soup. Continue your hypertension medications as prescribed earlier. Follow the instructions as described in home-based physiotherapy plan. Patient's feedback. The patient was initially a little frustrated but now feels highly positive and energetic after treatment. And here are the references.